Hello everyone, I hope you all are doing good. So I started studying again for my surgical viva exam in ERPM, and this time I thought that I would start my studying again with orthopedic topics because that is the part I usually tend to skip towards the exam. So I thought this time I will go through these topics thoroughly and really study these topics. So I chose Dupuytren contracture as the first thing to start my studies with. So without a further ado, we'll see what do we have to study here. So I'm going to discuss what is Dupuytren contracture is and what are the causes for the development of this condition and how the patient present and what are the differential diagnoses and what are the examination points that you have to know, and is there an investigation to diagnose this condition and what are the treatment options. And also at the end of the video I will share a study tip that I have learned recently through the YouTube. It helped me to study topics that I usually don't like, so I thought it would be helpful to you all as well, so I thought I will share it with you all. So we'll see what is Dupuytren contracture is. Guys, the Dupuytren contracture is a condition that mainly affecting our hands. Actually, hands are not the only side that can get affected by this condition. We'll see what are the other sides later, but mainly hands. Okay, so in hands, we know there is palmar aponeurosis in this area. In the palm, there is palmar aponeurosis. So this palmar aponeurosis get thickened mainly towards the ulnar side. That means this little finger and the ring finger. These two fingers mainly get affected because it's mainly affecting the ulnar side of the finger. But radial side also can get affected, but mainly ulnar side. And because of this thickening of the palmar fascia, flexion contractures develop. So what is this flexion contracture is? These fingers get flexed like this. What happens is it will get flexed from the MCP joint and DIP joint. You all know these are upper carpal bones and these are our metacarpal bones and these are phalanx. In phalanx, this is the proximal interphalangeal joint PIP and this is the distal interphalangeal joint DIP. So what happened in this condition, because of the thickening of the palmar fascia, there will be development of flexion contractures of this side mainly, but it can affect the other side as well, the radial side as well, but mainly the ulnar side. So the fingers will get bend or flex in these joints, MCP or metacarpophalangeal joint and PIP joint, proximal interphalangeal joint. So the hand will be like this in case of these patients. Okay, guys, don't get confused with the ulnar claw, since this condition is mainly affecting the ulnar side. You might get confused with ulnar claw if you are not familiar with patients, because in ulnar claw there will be hyperextension of the MCP joint. In Dupuytren there will be flexion of this joint. This is MCP joint and this joint is flexed in Dupuytren contracture, but in ulnar claw there will be hyperextension. So it will be like this, but bending or flexion of this interphalangeal joint. So it will be like this, but here it's like this. If you are not familiar with the patient, you might get confused of this condition because both sides are mainly affected. Ulnar is anyway, it's ulnar side, but in Dupuytren's also it's mainly affecting the ulnar side, no, so you might get confused. So be very careful, observe very clearly. In Dupuytren's, if it is bends, if it has bends from here, it's like this, it's Dupuytren, but if it's like this, it's ulnar claw. Okay, so what happened is, because of the thickening of the farmer fascia, there will be flexion contractures. Um, Before developing of these flexion contractures, there will be some other features as well, because this disease has stages. In early stages, there will be palmar nodules in a patient with developing Dupuytren contracture. In the palm, you can see some like nodule appearance in the palm. You can feel it and you can see it. Okay, that's the early stage. There will be no contractions of the fingers. He can bend and extend and flex his fingers, no problem. But there are some nodule appear in the palm. Okay, sorry for the pronunciation. And other than that, in early stages, the patient might also have skin puckering in this area. Then with the disease progress, there will be cord formation in these fingers. Like this, from the farmer fascia, there is a cord-like appearance. Okay, there is a cord-like appearance. So this cord pulls the fingers. These fingers are getting pulled by this cord, so that's why they bend like this. So with advancement of the disease, these flexion contractures develop. But in the early stages, there will be skin nodules, skin puckering, cords of the palm and digits. After forming cords, there will be flexion contractures. And there is another specific feature which we can found on the dorsal aspect of the hand, that is Garrot's knuckle pads, that is thickening of the skin. It's like small nodules, thickening of the skin in the on the proximal interphalangeal joint. Okay, that's the main clinical, those are the main clinical features that you can see in Dupuytren contraction. Okay, now we'll see what are the causes that contribute to this condition. Like mainly, I forgot to say, I didn't know this fact earlier, that this condition can be genetical. It's a autosomal dominant condition and it could be a genetic condition. So other than that, there are some acquired causes as well, like chronic smoking, chronic alcoholism leading to cirrhosis, then AIDS, epilepsy, hypothyroidism, trauma, then like some chemicals like phenytoin sodium, these can contribute to development of this disease. Other than that, genetical aspect, it's autosomal dominant condition. Okay, mainly the men's get affected by this condition. So this condition is more prevalent in males than in females, and especially men's in their 5th and 7th decades are more prone to development of this disease. Okay, okay, we know that mainly the hand is affected by this condition, but it's not only the hand. The foot also can get affected by this condition. The plantar aponeurosis of the foot can get thickened because of this condition. Okay, we know that mainly the hands are affected by this condition, but there are some other side that can get affected by this condition, like in foot, because of the thickening of the plantar aponeurosis, there will be clubbing of the toes. So this condition is known as Lederhose's appearance or Lederhose's disease. I hope I pronounce it correctly. I don't know how to pronounce it correctly. I think it's Lederhose's disease. Then other than that, in case of males, the penis can get affected. So when the patient get affected by this condition, there will be a bending of the penis towards the side when it get erected. So that condition is known as Peyronie's disease. I think I pronounce it correctly. And okay, these are the main two other sides that can get affected by this condition. And so we discuss what is it and what are the causes for it. And what is the presentation? But presentation means we discuss the patient present with like contracture of the hand, usually a male patient, and there will be bending of MCP joint and PIP joint. Guys, please don't get confused with the ulnar claw, because in ulnar claw there is hyperextension of the MCP and flexion of the PIP, because that's a very common condition. And also if you are not familiar with that condition, these two conditions, you might get confused. So please remember that there will be bending in these two joints, PIP and MCP, in this condition, but in ulnar there is hyperextension and flexion of the PIP. Okay, so we discuss okay, so the differential diagnosis is ulnar claw for this condition. Okay, then I told you this is mainly a short case in a surgical viva exam in ARPM. So in short case, you should know, examiner might say, okay, when you go to the patient, examiner might say, examine this patient hand. So you should know how to properly position the patient and how to expose the patient adequately, and what are the points to check. You know now what are the points to check in the hands, what are the joints that have flexed, and in case of positioning of the patient, usually the patient should be in the seated position, and you should ask the patient to keep his hands like this on his lap, or you can keep a pillow and ask the patient to keep his or her hands on the pillow. And if this is the affected side, you should start your examination with the normal side first. So examine this hand first, both sides, and then go to the abnormal side. Okay, and describe what you see here. So in this case, there will be flexion of the MCP joint and PIP joint. So you can decide that this is Dupuytren contracture. If they ask what are the differential diagnosis, now you know that's ulnar claw. So other than that, if they ask what are the other side that you would like to examine, since this condition can also affect plant aponeurosis, so you can say that I would like to examine foot of this patient, and also if it is a male patient, you can offer to examine his genital area because of the Peyronie's disease. Okay, so these are the examination points that you should know. And what about investigation? I think there's no investigation for this condition. I'm not sure. Please let me know in the comments if I'm wrong. This is a clinical diagnosis solely, so there's no investigation for this. We'll see what are the treatment options. Okay, in treatment option, I told you that there are stages for this condition, right? So in early stages, there will be nodule formations, skin puckering, and cord formations, and only after that there will be development of the contractures. So in early stages, we can try to avoid risk factors. So because there are some acquired risk factors that contribute to development of disease other than the genetical component. So we can avoid these risk factors like chemicals like phenytoin sodium, and if the patient is diabetic, we can correct it. Then if the patient is hypothyroid, if the patient is having thyroid disorders, we can correct it, and we can ask the patient to stop smoking and stop taking too much of alcohol. Like that we can correct. And other than that, we can try physiotherapy, and the surgical option is excision of the palmar fascia. We go for surgical option when there are development of the flexion contractures. Actually, if we don't get treatment earlier, like the surgical correction earlier, the patient might develop severe contractures leading to very uncorrectable contractures. So severe contractures. Even though you do the surgery in this patient, excision of the palmar fascia won't help to get corrected these contractures. So we might have to amputate the fingers because these contractures might interfere with day-to-day activities of the patient, and patient can't perform normal functions that he would perform with his hands, his or her hands. So we have to go for amputation as well. So in early stages, we can try avoiding risk factors and physiotherapy. Then surgical option. Before development of severe contractures, we can do excision of the palmar fascia. When you excite the palmar fascia and during surgery, we have to be careful because there are digital nerves trapped inside this thickened palmar fascia. So we have to be very careful not to damage these uh, nerves, because if these nerves got affected or got damaged, the patient will develop any sensory difficulties, like. Okay, then other than that, if the flexion contractures are affecting or interfering with patient's day-to-day activity, we have to consider amputation as well. So that's it about the Dupuytren contracture. So guys, I told you at the end of the video I will share a tip to study any topic that you usually don't like to study. So the tip is, let's say Dupuytren contracture, you want to study Dupuytren contracture, but you don't really like that topic. It's not a very interesting topic to you. So what you do is, you go to the Google and you type Dupuytren contracture there, and you go to the news feed. In the news feed, you should find something that catches your eye, like something related to a person that you know very well, like a celebrity. So what I did when I started to study this topic, before studying this topic, I went to Google and typed it there, and in the news feed I found some interesting article about. In the news feed I found that about Dupuytren contracture. A celebrity got affected by Dupuytren contracture. So I started reading that article, and actually I found it really interesting because it's like reading a story. So I found really very important topic, sorry, not topic, very important facts about this condition. Because for an example, that the article I read was about Bill Nighy, who was a very famous Hollywood actor. He acted in the famous movie Pirates of the Caribbean, and he has said that this is a condition that he got from his mother's side. So I thought, okay, this is a genetically inherited condition. I didn't know that before earlier. So I learned that from there, and after that he has mentioned over the years how he got affected by this condition when he first developed this condition, and now he's 70 years of age, and how the life has been for him with this condition, and how his acting career got affected with this condition. Like that, it's like a reading story. It's very interesting, and I could found really important and very interesting facts about this condition. Okay, so after reading that article, um, I read my note. When I read my note, I usually use Bailey and Lowe's, and also the class notes that I previously attended. When I read that notes, it's actually very easy to understand and very easy to remember, um, because I have a very rough idea about this condition. So I think this technique actually works very well for everything that you want to study but you don't feel like studying. So I thought it would be helpful for you all as well. So that's why I thought I should share this technique with you all guys. So that was the tip. And please let me know what you think about this video, because I'm not an expert at making videos, and there might be so many mistakes in these videos. And even though the points that I'm talking in related to this topic, um, please let me know in the comments, and give me a like uh, if you get something from this video. I'll see you in my next video. Okay, thank you. Have a good day.